What is yellow fever? Yellow fever spreads through certain mosquitoes found in Africa and South America's warm regions. These mosquitoes get the virus from biting monkeys or infected people. Some folks might not feel anything if they catch it, but for others, it can feel like a bad flu with fever and body aches, or it can get really serious, causing bleeding and liver problems. It usually takes around 3 to 6 days for symptoms to show up. Who does yellow fever affect? People who work or live in the jungles of subtropical and tropical Africa and South America are most affected by yellow fever. Travelers from the US or other countries to these areas are exposed to this disease by contaminated mosquitoes. How common is this condition? There are about 200,000 people in the world who are infected each year with yellow fever. The condition causes about 30,000 deaths per year. Most of these cases and deaths, about 90%, are in Africa. What are the signs and symptoms of yellow fever? Yellow fever typically presents with symptoms that can range from mild to severe. In the initial stages, individuals may experience fever, headache, muscle aches, and loss of appetite. These symptoms can often mimic those of other common illnesses, making it challenging to diagnose. As the disease progresses, more severe symptoms can manifest, including jaundice, yellowing of the skin and eyes, abdominal pain, vomiting and bleeding from the mouth, nose, eyes, or stomach. This advanced stage, known as the toxic phase, can be life-threatening and requires immediate medical attention. In some cases, patients may enter a brief period of remission before experiencing a recurrence of symptoms, which can be even more severe. It's crucial to seek medical care promptly if experiencing any symptoms of yellow fever, especially if living in or traveling to areas where the disease is prevalent. Vaccination is highly effective in preventing yellow fever, and early diagnosis and treatment can improve outcomes for those infected. What are the causes of yellow fever? Yellow fever is caused by the yellow fever virus, which is transmitted to humans primarily through the bite of infected mosquitoes, most commonly the Aedes aegypti species. These mosquitoes acquire the virus by feeding on infected humans or non-human primates, such as monkeys, which serve as reservoir hosts in tropical and subtropical regions. The virus can then replicate within the mosquito's body before being transmitted to another human during a subsequent bite. Yellow fever is endemic in parts of Africa and South America, where the environmental conditions are conducive to mosquito breeding. Urban outbreaks can occur when infected individuals introduce the virus to densely populated areas, leading to rapid transmission among susceptible populations. While human-to-human transmission can occur through blood transfusions or needle sharing, it is rare and does not sustain the spread of the disease. Prevention efforts primarily focus on vaccination, mosquito control measures, and surveillance to detect and respond to outbreaks promptly. How does yellow fever spread? Yellow fever is spread by specific types of mosquitoes found in tropical and subtropical Africa, Saharan Africa, and South America. The infection spreads when the infected mosquito bites a person. Is yellow fever contagious? You can't spread yellow fever to another person if you have it. For instance, you can't spread it by coughing or kissing. However, if you are infected, a mosquito can bite you and then infect someone else. How is yellow fever diagnosed? If you've been to any area that has yellow fever and you develop any symptoms, you should see your healthcare provider immediately. In addition to asking you about your symptoms and the places that you've visited, your provider will order tests to find out if the virus is in your blood. Why yellow fever is called yellow fever? The yellow in yellow fever refers to the color of your skin if you have jaundice. The infection also usually comes with fever. Thus, the condition was called yellow fever. How yellow fever is treated. Yellow fever doesn't have a specific treatment, so medical care mainly focuses on managing symptoms and complications. For mild cases, doctors recommend rest, hydration, and over-the-counter pain relievers to alleviate symptoms like fever and body aches. In more severe cases, hospitalization may be necessary. Patients might receive intravenous fluids to prevent dehydration and maintain blood pressure, along with medications to manage symptoms such as pain, fever, and nausea. In cases where there are liver or kidney complications, specialized medical interventions may be required. While there's no cure for yellow fever, early detection and supportive care can improve outcomes. Prevention through vaccination and mosquito control measures remains crucial in areas where yellow fever is prevalent. Does yellow fever still exist today? Yes, the virus is still active in Africa and South America. The US hasn't had an outbreak since 1905. Is yellow fever the same as malaria? Yellow fever and malaria are different diseases caused by different pathogens and transmitted by different mosquitoes. Yellow fever is caused by the yellow fever virus and transmitted by Aedes aegypti mosquitoes, while malaria is caused by Plasmodium parasites and transmitted by Anopheles mosquitoes. Both can cause fever and flu-like symptoms, but they have different clinical presentations, complications, and prevention strategies. Yellow fever can lead to severe liver damage and bleeding, while malaria can cause complications like cerebral malaria and severe anemia. Prevention for yellow fever involves vaccination, while malaria prevention focuses on mosquito bite prevention and preventive medication.